few important topics which were asked in Inicet November 2020. They asked a question on intermittent claudication. Now this is a repeat question. This was already asked in November 2022. They asked what was intermittent claudication. Intermittent claudication is basically pain after walking certain distance, and it's a vascular pain. So the concept here they are testing is whether we are able to differentiate between a vascular claudication and a neurogenic claudication. In neurogenic claudication, the pain occurs after the first step, whereas in vascular claudication, it occurs after walking certain distance. 2 years back, they had already asked a question that pain improves on going downhill, pain increases on going uphill. There was pain around a specific group of muscles, that is calf muscles. What was the type of pain? They asked the type of pain. Back then, it was a vascular pain. It was basically vascular claudication. But in this session, they directly asked the intermittent claudication, which was nothing but pain after walking certain distance. So next time in Inicet, what is important is to study the previous year topics. Now next time they can ask you the Boyd's grading of pain. Grade 1 being pain which occurs on walking but improves on further walking. Grade 2 being pain on walking but patient continues to walk with pain. Grade 3, the pain occurs in such a way that it compels the patient to take rest. Grade 4 being rest pain. Similarly, they can ask question on ankle brachial pressure index. So in this way, whenever you're reading a previous year question, it's basically the PYT is important rather than the previous year question. Now let's see another topic, which is neuroendocrine tumor. They basically asked a question on gastrinoma. They asked about the Passaro's triangle, the most common site of gastrinoma being duodenum. They asked the boundaries of Passaro's triangle. It's formed by second and third part of the duodenum, junction of the cystic duct with the CBD, and the body and the neck of pancreas. It was a repeat question and it's an easy question. The thing is, next time they won't ask the same question. They will ask what is the investigation of choice for gastrinoma, which is fasting serum gastrin levels being more than 10 times the normal. And a trick question would be what would be the investigation of choice for localization. If they ask investigation choice for localization, then it will be somatostatin receptor scan, which is known as octreoscan. The thing is, in AIMS, one unit does vascular surgery. There will be a vascular question. Neuroendocrine tumors are commonly operated, so there will be a question on gastrinoma. In this session, there was a question on gastrinoma. They asked the location. Next time, they can ask the investigation, or else they can fall on to insulinoma. They can ask about Whipple's triad, which is basically having hypoglycemia, correction of the hypoglycemic symptoms following consumption of sugar. So this is the way we have to study for Inicet. Questions are easy only when you have read them. Similarly, they asked a basic question on bed sore. In bed sore, they asked about stage 2. Stage 1 is basically erythema with intact epidermis. Epidermis is intact. Stage 2, there's breach of epidermis. This is basically an ulcer. It involves the epidermis and dermis. Stage 3, the ulcer extends to the subcutaneous tissue. In stage 4, it involves the fascia and muscle. This time I think they asked there's an ulcer which is invading epidermis dermis. Next time they can give a image based question if not given this time, or they can ask the management. Next time they can ask about WAC. So this is how we study. Basically, when you solve previous year questions, you should predict questions which will come in next session based on the previous year topics. Similarly, they asked question on dysphagia. This is a basic flowchart which can clear the question on dysphagia. First of all, dysphagia can be pharyngeal one or esophagus one. If the patient is having difficulty in initiation of swallowing, it is basically a pharyngeal one, but our focus would be on esophageal dysphagia. They said in the question, a guy had difficulty in swallowing to solids then liquids. It's basically a structural problem. In dysphagia, esophageal dysphagia, we have to categorize things as whether there's a structural problem or whether motor disorder. These two things should be pretty clear before coming to a diagnosis. If the examiner says the dysphagia was first to solids, then it progressed to liquids, then it's a structural problem. Then they will mention in the question that whether it was a progressive one or non-progressive one. Even if they don't mention, if they say there's weight loss, there's anemia, it's a carcinoma esophagus, which was probably the question which was asked. But if they say there's a chronic heartburn associated with the dysphagia, which was initially to solids to start with, then it can be a peptic stricture. And if they say there was a non-progressive dysphagia to solids then liquids, then it can be rings or webs which can be the cause. Scharsky's ring, which is submucosal fibrosis. But if they mention the dysphagia initially started to liquids, then progressed to solids, or it was predominantly to liquids, then it is basically a motor disorder. So this session they asked patient had dysphagia to solids then liquids. It was probably carcinoma esophagus. But next session they won't ask the same question. What they can ask is, they can give the same profile and ask what is the next best step. So obviously you want to confirm your diagnosis. If you're suspecting cancer, you want a tissue diagnosis. So you will scope it and take a biopsy. So do an upper GI endoscopy. Or they can also ask, they can give you a profile of motor disorder, like they can say the patient had dysphagia to liquids, then it progressed to solids. Then you have to identify it as motor disorder. Then the next best step becomes barium swallow, not endoscopy. So this is how examiner will change the language of the question, change the mode of asking a topic. Previous year topics are important more than previous year questions. These concepts only fetch you marks rather than anything else. And a question was also asked on the age-old topic of Inicet, that is tension pneumothorax. Mostly people don't get it wrong, but they give a clinical profile mostly in this case. There will be, say, history of trauma with hypotension, with respiratory distress. Basically, three differentials can be there in such a case. One being tension pneumothorax, other one being cardiac tamponade, and the last one being massive pneumothorax. If they say there's hypotension, respiratory distress, and jugular venous pressure is low, it is straight out massive pneumothorax. But if they say there's hypotension, respiratory distress with raised JVP, two differentials come to our mind. One is tension pneumothorax, one is cardiac tamponade. But if they clear the thought by saying that there is hyperresonant note on percussion, then it will clear the thing that it is a tension pneumothorax. The next best step would be needle decompression. But if they ask definitive treatment, definitely after needle decompression you have to put the chest tube. You will not just leave the patient just like that. If they say there is history of trauma with hypotension, with respiratory distress, raised JVP, but muffled heart sound, then it's a cardiac tamponade, for which you do needle decompression. So this basically 5 questions which I have discussed. My main motto of this video was to tell you that previous year topics are important. Reading the topics carefully, predicting the questions based on the previous year questions is important. That will fetch you rank, that will fetch you the college you want, rather than just mugging up the previous year questions which every other buddy does. So if you want further discussion of previous year questions of surgery, please let me know in comments. I will discuss. If any concepts you want to clear, I will clear it. I am a surgery resident right now in AIMS, so feel free to discuss.